I'm Rajendra Shah. I want to start my presentation. First, I want to give the brief timeline. First, I want to discuss a sample of the timeline. Um, timeline varies with everyone, but well, we need to know their timeline, the residency programs timeline, so that we can plan better. For this, if the step one is given in October or November, like suppose if we give step one in October or November, then after 4 5 months we can give step two in CK, step two CK in after 4 5 months. Then in 1 or 2 months we can give CS. Then we can do the observerships, get letter of recommendations, and then for the interviews. So I will talk in detail about everything. Okay. As I said, the most important thing is planning here because this is a long journey. And as Dr. Vijay said, we get frustrated in times during the preparation, and when we are not getting the score which we are expecting, when we are not getting the score in the assessment we are expecting. So we need to be focused and motivated throughout the preparation of the USMLE. So it basically consists of step exams, which is step one, step two CK, step two CS, step three, and then United States clinical experience, which has to be at least 2 to 3 months, or even if more than 2 to 3 months, then it's better for us. Then we also need to have letter of recommendation. That is one of the requirements from the programs to apply. We also need to have research or publication as much possible. Then networking. Networking is why I have kept networking over here. Networking means connecting with people whom you know who is doing residency in the United States, who is working already here, to get familiar with their programs, with the programs in the United States. That will definitely help. That will help in different ways. Like when you're applying in the program, you can ask that person to recommend you in the hospital in their program, and you can also have information about their program, what is the size of program, how the program works, what are the type of students they take. Because in US, what happens is there are some programs that only accepts green card people. There are few programs that are more IMG friendly, few programs that are less IMG friendly. So that kind of information we need to have, but that's not during the initial phase of the preparation. That's something after the exams. As I said, this is step exams, step one to CK to CS. After finishing all these three exams, we get ECFMD certified. And there are some changes this year, which I will be talking later in my presentation. So after we get ECFMD certified, we need to give the exam step three. So that is something like not necessary to apply for the programs, but it's better if we do it before getting into the residency. The scoring system is the full mark is around 300, but they are having a new system of pass and fail, which I'll be talking later on. So let's talk about the step one, which is the most important thing, and why I'm saying this is most of the people, what happens when they are starting their preparation, when they are in the initial phase, during the step one preparation, because it's a long time, long duration, like 10 to 12 months. And most of the people, leave the preparation while they are doing the step one. The chances are the person might leave the preparation, entire USM preparation during the step one, when everything is not happening according to their plan. So my advice here is just to be persistent and have patience and keep working hard. So the average duration I can say is 10 to 12 months for an average student. And for the study materials, the first and the foremost is Kaplan videos. So we need to see the Kaplan videos. Um, they explain everything very well. They will try to understand. They will try to make you understand the concepts. So that is available, like 2014 videos, which I had I had when I was preparing. So there might be some latest one these days. So we need to do Kaplan videos for all the subjects except pathology and physiology. So for pathology, we need to study Dr. Sattar's pathoma. For physiology, BRS physiology. So what is how to study the Kaplan videos? Like they are the videos. We are not familiar with that. So in our MBBS, we used to have classes and then we used to see the patients. So that's how we are preparing for the exam during the MBBS. So this is kind of a new thing for us, and that's why we need to be persistent and we need to talk with the people who have already done to get more to get more familiar with these kind of videos. So we need to have the hard copy book for the Kaplans. The latest one, 2020, is available, and then we need to annotate the things which are not on the book and said in the videos. Because in videos they will talk about everything which is not available on the book. So we need to annotate while we are reading for the first time everything which is not present in the book. Once we do the same thing for all the subjects, and also I would also like to suggest to study first aid. Like if for example, let's suppose I'm studying anatomy for now, like I'm doing Kaplan videos for now for the anatomy. So what I will do, I will annotate everything which is not in the anatomy book, Kaplan book, everything there. And once I'm done with anatomy, I will study first aid, just the anatomy only. I would want to talk about the first aid book. First aid book is has like a very compact type of information, so it's very difficult if you start reading first aid before doing Kaplan videos. So once you are done with the Kaplan videos and then you do the first aid, then it will be like, there will be there will be many things which you will not understand, but that will definitely help you. So the plan is to do the Kaplan videos, annotate on the book, then do the first aid and finish every subject likewise. Okay, so once we are done with all the subjects in this manner, then we will go with the another is UWorld question bank. So this is what is UWorld question bank. The UWorld question bank is a bank prepared by the doctors who were working in the United States, and these questions are similar to the questions which you will be seeing in your actual USMLE exams. It's not the same, but it's a similar concept. So suppose if we are seeing a question about sarcoidosis in the UWorld Bank, and if then you will learn about everything about the sarcoidosis, how it's tested, how the questions in the appear in the main exam. So the questions are basically similar format, similar length, similar types of options, similar ways to do. And then there are other sources like Boards and Beyond. They have the videos as well, so you can consult Boards and Beyond when you are having this hard time understanding some topic. And then I already talked about the first aid. So for now, once we are done with the Kaplan, once we are done with the first aid, and then in the U world, while we're starting, I would advise to do the self-assessment exams. So what are self-assessment exams? Self-assessment exams are NDME and U world self-assessment. And there are other as well, like USMLE free 120 questions. So what I will suggest to start doing NDME from one while you are doing your U world. And after each NBME you do, you need to figure out what are the what are the topics which you are weak in, because without improving your topics, without studying, focusing on your weak points, there's no benefit of doing another assessment and just checking your scores. So I will suggest you to do the UWorld questions, understand every option, not just the right answer, every option, the wrong answer, why it is wrong, why it is right, what are the concepts they are testing, what is the educational objective of this question. So the UWorld needs to be studied thoroughly, and each and every word of UWorld is very important. And the self-assessment will help you guide the preparation, like it will show you how your score is improving, the topics which you were weak while doing NBME 1 assessment, now you are good in that topic or not, because new topics will keep arising, like so you will have your regular preparation, and then you will have 1 or 2 hour of uh, special hour for the your weak topics. Okay, and so this is about the materials. What are we doing? And now let's talk about how to study, whether to study at home all alone, or whether to study in a group. So my experience in this is group study helps a lot. So initially what I had done, I studied alone in my home for like 2 3 months, and then I was frustrated because my NVMe score was not improving as I was expecting. But then I went to the then I started group studying in one of the libraries. There are many libraries in Kathmandu. If you talk, then mirror reading room or PC reading room. So the benefit there is, like, there will be many people preparing for the same exam. You will find people doing step one, step two. You will find, so group study helps in a way that you need to discuss some of the topics you might not be getting. You can ask your senior. You can also discuss among your friends who is in the reading room. Like what we used to do, we used to have a discussion of around 1.5 hour every day in the evening about the past questions. So past questions comes here. Past question is something you will find in when you start doing, when you start studying in the library. Everybody has their few recent past questions, and that is something you can also create. Like you can also collect. Like if suppose if your friend just gave step one exam a week ago, then you need to meet your friend and you need to talk with him, that what were the questions, how were the questions format. Like you can have a brief, he can you can ask him to write few questions, like more 100, or like whatever he remembers. So in that way you can have a collection of the recent past questions you can also get from the library. And that really helps a lot, and discussing past questions, because once you start getting into the questions, you will find that there will be questions like which you will have no idea what is the topic will be the same, like as I said about the sarcoidosis, but they will be asking question about the sarcoidosis which we will not have any idea. So discussing with friends helps a lot, and there are different topics like microbiology, pharmacology, that is very difficult to retain. So if we discuss among our friends, and then it will help a lot. So my suggestion will be doing system wise first, everything like anatomy, physiology, and doing system wise. Okay, and then keep practicing. You world is very important thing, and the suggestions will can be like, not to worry, like everybody has their own story, everybody has their own timeline. So do not think that somebody just finished step one in 6 month or 7 month, and I'm still in my ninth month, and I'm still not ready for the exam. So always try to be with the people who keeps encouraging you, and to be with your friends who is like preparing for the step one and keeps encouraging you, giving you positive vibes. So it's not a one day, it's not a hard and fast rule. You keep learning, keep make improvements, you keep working on your weak points. You learn, and then you have another weak points, and then you keep doing like that. So there's no rigid process. Everyone has to work hard, and the thing is, like, we often get frustrated like while we are preparing for the USMLE, because like this is a long process, right? So what happens, our friends get selected into the like competitive exams in India, in Nepal, and everywhere, and then we think like, we're still in the process, we're still nowhere. Like this is just a step one, so we are nowhere in getting residency in the United States. So, during that period, what I will suggest you to just have a break for a while, like for 2 3 days, or you can go on a break for a week and then start again. So this is how it works, and everybody has their own way of taking break and making study timelines. So that was about step one. So now I would like to talk about the step two. So the duration is usually 4 to 5 months, but as I said, like it depends on everyone, like how much you are giving. If you are studying just for 2 hours in a day, and you will think like I will finish in 5 months, then that is of no use. So the timeline, the total duration depends on everyone. So the average duration is 4 to 5 months. Here, what we use, we don't have Kaplan videos to see in the step 2 CK. We start by doing the UWorld questions. UL questions and get a subscription for UL and start practicing UL and see what are the topics you are weak in and start working on your weak topics. And there is another source as well, uptodate.com. So that is something the people here in the United States, they follow uptodate.com for everything, like for your as a reference material. So suppose you are studying about a topic in UL and you're not getting into it, you're not understanding what will be the management and all, then you need to go to the upgrade.com. So that is a kind of paid subscription, but you can have different ways to get it. So you need to, that has to be your reference. Then we have board basics. That is a book which we study to give the board exam here after 3 years of internal medicine residency. So that is, you just have to go overview. You don't need to know each and every word of the board basics, but for the UL, you need to know each and every word, all the wrong answers, all the right answers and everything. So master the board, there is for UL step to CK, but I never used it. For step to CS, what used to happen earlier, they used to have an exam, and in the United States there are like 5 or 6 locations where we used to go, and we used to see like 12 patients, and we used to take history and like make a note on the computer. So for this year, they have changed few things about the CS exam, as it is suspended for 12 to 18 months, and there are other ways to get ECFMD certified, which I will be talking. Then the self-assessment tool, I didn't mention UWSA. UWSA is something you should not do earlier. That is something you should do while you are about to give your exam. Like you are all set to give your exam in a month or something. Then I would suggest UL step one, UL self-assessment tool one, UL self-assessment tool two. So the two is the most predictive one. These UWSA are very predictive. Like if it shows a score of like 220, then you are not supposed to move forward with the exam. You need to rethink what are the areas which I need to improve. Then improve. Then only you need to move forward, because these are kind of very predictive things. So now I just want to talk about the recent updates about the ECFMG certification. As I said, for ECFMG certification, you need to have your step 1, step 2 CK, and step 2 CS. And once you are ECFMG certified, you are allowed to give a step 3 exam. But for now, step 2 CS is suspended for about 12 to 18 months. So how to proceed from here? So USMLE and ECFMG, they have a few guidelines how to proceed. So this is the slide which I have mentioned, like how to proceed. Okay. So the next will be like, there are a few pathways. So how to proceed? So what I found for us people in Nepal, everyone of us have the medical license given by the Nepal Medical Council there. So there are 5 pathways. There are 5 pathways here. So I will come back to the other slide as well. So there are 5 pathways. So for us, this pathway 1, it works, already licensed to practice medicine in another country, right? So what happens is, when we have one pathway, when we are eligible for any of the pathway of the 5 pathways, then we need to give the English language proficiency assessment, which we can find in the ecfmg.org, usmle.org. This is the English language test exam which we can give in our home country in Nepal. There are many centers for that. Okay. So for now, what will we be doing? We'll be doing step 1, step 2 CK, and then this English language proficiency test, and then we are done with, and then we apply for the ECFMD certification, and then we are applying for the step 3 exam. So the rest of the thing, like what to do after you are done with your step 1 and CK, and certified, and then about the letter of recommendations about the United States clinical experience in the United States. My fellow speakers will be talking about that. But before finishing my presentation, I just want to focus a few more things. So this is a long journey, as I said many times, and people get frustrated, and that is the main reason why everyone is preparing step 1 preparation, and so that is the most important thing. Once the step 1 is done, like, it becomes easier for everyone, and there is less chance that anybody will quit the preparation. So the most important guidance is having patience, because we have to prepare for a long period of time. We need to be persistent. Even when we have bad times, we need to like, just have a break and then back to our study. Then we also need to know the pros of the USMLE. Why USMLE is important for us? Why I am doing? If we are motivated, why we are doing? If we are dedicated, then it's not impossible. Like many of the people from Tarai area, many of the people from Nepal and other different countries. When we come here, we will find there are people of all over the world competing and getting into the residency here. So we need to think why we are doing residency, what are the benefits, what are the benefits I'm looking for. You also need to be persistent and have patience in your preparation. Can you please mute? Okay. So this is a short presentation about the USMLE preparation. I have my name already there, so you can contact me if you have any other questions. You can contact me later as well, and today also at the end of session. If there is question, I will be very happy to answer. And I just want to say like it's possible, and if you start doing it in a group, and if you start talking with everyone who is doing the step preparation, then it's not a big thing. Thank you.
Okay, thank you, Rajendra, for your nice overview. I'm sure the audience will have lots of questions listening your presentations, but I can assure you we have a question and session at the end of the presentations where we try to answer most of your questions. Our next presenter is Dr. Sumit Yadav, who is also from Janakpur. He is a PGY3 doing residency in St. Joseph Hospital, Michigan. So he is going to talk about some visa issues and travels after finishing step 1 and CK Nepal. So Dr. Sumit, please go ahead.
So, Vijay, I cannot start my video. It says it's blocked by the administrator. Okay. Good. Good evening, everyone. My name is Sumit Kumar Yadav. I'm internal medicine resident at St. Joseph Mercy Oakland in Michigan. And I'll be discussing regarding USMLE today, regarding our travel and visas. And I also included some financial aspect of it, but I'm sure somebody else will be also doing the financial aspect with the travel and visas. So let me share my screen with you guys. Are you guys able to see my screen?
No, sir.
Okay, let me see.
No.
I think Sumit, you can send the presentation to the host, and then he might be able to share his screen.
Okay, so how do I share it to the host?
You just please post that in the messenger group or in the WhatsApp, wherever possible.
I can post in the messenger. Sorry about the delay.
Again, can you help him or
Or
anybody?
Yeah, sure, that, sure that. अभिषेक कोर्स बनाइदेऊ न
Sumit, I think you can, continue while you send your presentation to Ramgyan or
yeah.
Yeah.
you can start talking, meanwhile.
Yeah.
All right. Just give me 1 second. I'll just send it right away, and then.
I've made Sumit the host. Can you please check once?
Yeah, not really. I cannot do it. Sorry about that.
Vijay Dai, I think we can give floor to the Ram Suresh Dai so that till then we sort out the technical problem we are having.
Okay, sure. Yes, try to reconnect Sumit.
Yeah, sure. I'll do that.
Okay, are you done? Are you able to share it, or do you need time?
No, I need time. Maybe somebody else can start, and I will join later.
Initially, Dr. Ram Suresh Mahato, he could not connect initially, so now I think he's ready. Ram Suresh Dai, do you think you can give a small overview about USMLE?
Okay. Can you hear me? Hello?
Yes.
Yes, sir.
Okay. Very good. Okay. So, namaste to everyone, people here and back home. My name is Ram Suresh Mahato. I'm basically from Sarlahi, Nepal. And I'm working as an attending psychiatrist in Hackensack Meridian Medical Group in JFK Medical Center in New Jersey, and I also work as an attending psychiatrist and addiction medicine specialist in Mount Sinai Mount Sinai School of Medicine in New York, in Queens. So I think Rajendra gave a very good overview of all the steps and what it takes to prepare all the steps. And the other speakers will also give you the overview of the visas, the financial aspects, and everything. So basically, I'm not going to give away everything, but I'll just tell you, USMLE, just like any other PG or postgraduate examinations, it is a series of examinations. There are 4 parts, and it takes a lot in terms of your emotional or financial and so many other stuff. So and, again, you have to remember, if you want to prepare for USMLE, you have to be ready with all sorts of challenges.
स्वास्थ्य हुनु न हाम्रो कति जना दाइहरु पास हुनुभयो
Hello. I think there is okay. So I don't want to downplay the risk and challenges. A lot of people come here. The match rate is still very optimistic, and it's perhaps much better compared to it used to be 10 years ago for international medical grads and foreign medical grads. I think it's above 50%, which is very good. When I came here, it was about 45%. But a lot of people also return back home because of so many circumstances. Could be visa, could be financial, or they are just not able to get into the specialty or the type of training they wanted to go into. Because as an IMG, you have limited. I'm not saying limited, but there are some specialties that are more likely you're going to match, but there are some other very competitive specialties that will be difficult for international medical grads, like ophthalmology, anesthesia, or dermatology, surgery, orthopedic, those kind of specialty. And also there is a basic difference that you all have to know. So In Nepal and India, when you go for a postgraduate education, you are given a different titles based on what kind of specialty you're training into. For example, you're going to surgery, you'll be given MS, medicine, MD. Here for everything is MD. Even if you do fellowship, you're still an MD. And postdoc, and everything is just an MD. In Nepal, it will be very different titles that you'll get based on the training that you'll receive, like MCH or DM, and so many others. So just to keep in mind, but you'll get to attend all different kind of boards, and it'll be board certified in all different specialties. But the title at the end of the day is still MD. Also, I think Sumit will start his presentation very soon. But if you have any questions or anything, we at the end of the presentation we'll have discussions on that. But I want all the aspirants to wish very good luck if you're preparing USMLE. If you get matched, it's very optimistic. There is a very high demands of primary care doctors in the United States. I myself, as a psychiatrist, I see that I'm needed everywhere. So if I apply for a job any place, I'm very much sure that I'll get in most of the places selected. So it's the scope is very positive for international grads. The pathway is very tough, and you will need a lot of support from your seniors, your family, your friends, and everyone, and whatnot. So good luck, everyone, and we'll continue. Is Sumit ready?
Yes,
Okay, all right, very good.
All right, so let me introduce myself again. I'm Sumit Kumar Yadav. I'm from Michigan, currently doing PGY3 at St. Joseph Mercy Oakland Hospital. So I'll be talking with regarding about travel, visa, and finance that's related with USMLE. All right, so let me start. So first of all, we're going to talk about like traveling to United States, and why do we need to come to United States if we are applying for USMLE? What's the point where we have to come to United States? So it's mainly when you start studying, when you are planning to, you are done with your step 2 CK and you are planning to get your step 2 CS done, then that's the point when you'll have to come to US, because step 2 CS is, you can only give it in United States. Also, for the USMLE step 3, you have to come, but it's kind of not prefer, like it's up to you if you want to do it before your maths or after your maths. And also you will need some US clinical experience. By saying US clinical experience, we also I'm also trying to emphasize on US letter of recommendations. So you will need at least 3 US letter of recommendations before you can apply for the programs. So when you do that, you actually have to work with a doctor in the US, obtain some experience, and that's how they will write a letter for you. Okay, and also for your interview, you have to come to United States. So these are like why you have to come to United States. Okay, so let's see what kind of visas you would be expecting when you're coming to United States. So basically, we have 2 kinds of visas, I would say. B1, B2, which are the visitor visa. This visa you will be using when you are trying to get your CS exam done, USMLE step 3, everything before your residency will be in the tourist visa, like visitor visa. You will be doing your observership clinical experience, your residency interview, everything will be on this visa. And once you start your residency, once you are masked, you will be processed for J1 and H1B visa. Those visas would be easy. Like those are easy things. Once you're masked, your program is going to recommend for you, and you will get those visas much easier. But getting your first visa is always the tough one. And coming to United States on B1, B2 would be a challenge. Okay. So let's talk about when to plan to travel. So I know Rajendra already showed you a timeline like about when to give MLE, USMLE 1 to CK. So as you also mentioned, like planning is the key. I want to emphasize more on that. So USMLE is all about planning. You'll have to plan about 2.5 to 3 years ahead of your time. You are dedicating your 3 years, nearly 3 years of your time for the USMLE. So you can find your timeline in the nrmpmaths.org. This is a website which deals with making the schedule for when to start the interview, what's the deadline for your submission of the application, and when would be the match date and everything. Okay, so I'm trying to show you like how you will prepare and what to expect during that time. Okay, so once you start preparing for your step 1, you'll take your CK exam and you'll have to take your step 2 CS, right? This is the time when you would want your visa. You will want your visa to go to United States. Okay. At the same time, you will also want to do your, let's see here in this one is more clear. Okay. So once you start your CK and you are at this point, you will be before CS, you will want your visa to be done. So I made a timeline for you. Okay, so this is for the July 2023. If you are somebody who is already studying right now, so this might not work for you, but this is someone who is just planning to start studying right now, then this timeline is gonna work for you. So if you are planning for the July 2020, it seems like a lot of time, but actually it's not a lot. So if you are planning for July of 2023 to get started residency, you would be you should be done with your step 1 in July 2021, which is like a year from now. And I would definitely say like for your step 1, you would be needing at least a year to prepare well. And for the step 2 CK, kind of like 5 to 6 months is okay. So you will plan for like December of 2021. That is next year. So you will plan for those time to done. After you are done with your step 2 CK, that's the point when you need a visa to come to US to give your CS and clinical skills and do the US clinical experience. So you will have to apply for your visa in like around January of 2022, and then you will plan for the travel in February 2022, and then you will come to United States and you'll have to do with your step 2 CS in March and April. Okay, so next thing about visa, the challenging thing is you will only get a visa to stay in the United States is maximum of 6 months. So you will have to come to United States at least 2 or 3 times during your entire preparation time. Okay. So this I made it because of you have to complete everything by September 15th. That's your time when you will have to apply for your programs. So based on that timing, this months and everything is kind of like ideal for you. You will not be spending a lot of money. It will be saving your money and it will work ideal for you. You will have like 3 or 4 months to spend after your CS examination, and that time you can use for the clinical experience. Let's see the next slide. So obtaining a visa. So you can, you have to give a reason why you wanna apply for a visa to the US Embassy. So you can say you are gonna do a USC or extensive, and you usually get a extensive when you are a student. Once you graduate from the program, usually you will not get extensive, becomes very difficult. So if you have any extensive document, like one of the university from the United States is writing you that you are coming to US to do a rotation. Like for example, like you can do, you will be doing nephrology or some rotation in your hospital, but instead you want to do a nephrology rotation in the United States. So you can apply for those. So those are called like your core rotation in Nepal. You can do it in US, and they will write you a letter to come to US. So if you have those when you are a student, you will get a visa very easily. Those are like easy things to get at that time. The next thing is when you are applying for a step 2 CS or step 3, you can ask for the visa to the United States Embassy. Because whenever you apply for CS and step 3, you can only give it in United States, and ECMG will write you a letter saying that the embassy if they can approve your visas. So those are the reasons why you can ask for the visa. And occasionally, if you have like interviews from the program, you can show it to the embassy saying that I have some interviews in the United States and I want to go to United States. So they might consider on those basis. So always be positive. I would say like the visas are always challenging. You will hear a lot of people saying uh, like 5 people last month applied and they did not get the visas. But at the same time, always be positive. There are a lot of people who apply and most of them are getting it out. Like if you have to ask me, more, about 70% of the people, like medical field people who are applying will get a visa. So you have to be very positive. You have to prepare your documents well. You have to know your reasons why you are going to US. You have to have your uh, letter that's written by the EC Hamzi to show it to them, hey, why am I going to US is here. The next thing I want to emphasize something is when you are studying for USMLE, usually everybody tries to study by sitting in a library and they don't work. So when you apply for the visa, they want to see if you are going to come back to Nepal. Like, what's the one motivation that you can show it to them that you are coming back to Nepal? So that you can show it by saying that you're employed in Nepal while you are applying, and your employer is giving you a leave for like 2 or 3 months to do these clinical exams and come back to Nepal. If you show these things, your visa process will get a little easier. Okay, they will consider like you are showing them that you will be coming back to Nepal after you are done with your visa. The next thing you will be needing for while applying for a visa is someone in the United States saying that you are coming to the US and you'll be staying with them and they will be taking care of you while you are in the United States. And they should be able to take your legal responsibility. So you will need a letter for such with someone in the United States. This person could be your senior, this person could be your friend, this person could be one of your family members. And most of the times, when you fill the visa form, you will be asked as well, how will you be supporting yourself in United States? Because average cost of staying in United States per month is like over $1,000. At least like $1,000 to $2,000 a month would be what if you come normally and nobody is supporting you. So that's also one of the reasons why you will be needing a support document, like a financial support document from the person who is who would be like with whom you will be living in the United States. They can write you a sponsorship letter. And always dress formal when you are going for an interview. So you can apply it online. There is a form called as a non-immigrant visa form. You can apply it online, and then you will have to pay it at the Nepal Investment Bank. And then you will go and take your date online. And also remember to anticipate like a month delay sometimes when it's a peak season. Usually in the February, March, it's kind of like their peak seasons. There will be a lot of USMLE grads that would be willing to go to United States, as well as there will be people from other fields like going to the college, they would be applying as well. So anticipate some delay on your planning at that time. And for your questions, the main questions they would be asking you in your visa is why you want to go to United States. You can say them like your reasons why you want to go, like for your STEP exams. And then you can they will ask you like, why don't you want to do internal medicine in Nepal? Such kind of questions. What are your STEP score? If you have a low score, they will ask you why you have a low score. And like if you have any immediate family members in the USA, what kind of visas are they on? And when do you plan to return back? What plans have you made to return back? And what do you want to do with after you are completed the residency? So mainly your questions, all your questions will be focused in seeing if you are going to come back from the United States or not after you are done with your USMLE exams. So you have to show them a positive things that why you want to come back. It's an indirect question, but they are trying to seek like if you are someone who is a potential person to be an immigrant in USA. So you just have to defend yourself that you are someone who is just going to US to give the USMLE exam. You will be you will be applying for a residency training, And you will, once you're done in 3 years, you will be coming back to coming back to Nepal. This is something you have to explain it to them well, show it by your documents, everything. You should show it to them that you have a job in Nepal, you are getting a leave for 3 months, and you are coming back to Nepal after you have done with your STEP exams. So this way, they will be more lenient in giving you visas. All right. So challenges that you will face during the visa, like even after you got your visa, you will face some challenges. So first thing is your visa could be you can only get a visa for like maybe 3 months, 6 months, a year, or 5 years, depending on your luck, I would say, and also depending on the conversation, how it went through, and who is taking your interview. It's completely a luck, I would say. So once you get a 3 months visa or 6 months visa, what does it mean? So it doesn't mean that you can only stay 3 months in United States, but actually it means that you have to go to United States within 3 months. If it is 6 months, you have to enter the United States within 6 months. You can enter multiple times during that period if you have been given like multiple visa. So if you have like 6 months and you plan to go twice, you can do that. So the next challenge comes is like how much duration you can stay in the United States after you get your visa. So that is decided by something in the, when you enter the United States in your port of entry, you'll have an immigration officer who is going to ask you questions like similar to you had before during your visa, like why you came here, how many, what are you planning to intend, where are you planning to go, those kind of things. And this officer is going to decide how much how much time you need to be in the US and how much duration are you going to be in US. So he's going to stamp it in your passport saying that you can stay in the US for 1 month, 2 month, 3 month, or 6 months. So this will decide like how much you will be able to stay in the United States. But the maximum you can stay at one time in the US is 6 months. So after 6 months, you will have to return back to Nepal, or you can file to extend it for one time for another 6 months. So the maximum could be 12 months, that's a year, but you cannot extend beyond that point. And usually who comes to the United States to give their residency, I have seen most of the people, they do extend their visas from 6 months to 12 months, but there are some consequences sometimes. Being said that is when you apply for the next time on a visitor visa, they might ask you, you extended your stay in the United States last time. So those are the challenging things, and you will have to be prepared for it beforehand. All right, let's see in the next slide. So I also wanted to talk about like financial burden with everything going with the USMLE. We now know about the USMLE, like the step exams. We know about the timing when to give these exams. So how about the financial cost of this exam? So I do have to tell you that this exam is like really costly. So you are expending like nearly $4,000 just to go to United States for the first time. When you are applying your visa, everything, like nearly $5,000, like including your visa fees with the embassy and everything, you'll be spending like around $5,000 just to go to the United States on your first visit. These are like slowly, like it doesn't happen like you have to pay $5,000 at once, but it's gonna be on a term of 2 years that you will be already spending like $5,000. After that, you go to the residency, like you will be applying for in September about the residency programs, and you're spending a lot of money there, like applying for the programs. If you apply for 100 programs, which is like the minimum as an IMG, I would recommend like doing 100 program, you will already be paying like around $2,500. If you're applying to 120 programs, you're paying 3,000. If you're applying to 150 programs, you're paying like nearly $3,700. So it is very costly. And at the same time, you'll have to add expenditures that you will be attending the interviews. If you get like 8 interviews, and if they are in New York, in the same area, same state, then it can be cheaper. But it's never like that. You don't want to take risks, because this is when you're applying one time, you're spending this much of money. So you don't want to take risks for the second time. So you want to make maximum out of it. So you will be applying to multiple states and multiple places, and if you get like 8 to 10 interviews, you're already spending like over like $15 to $2,000 in that, just for the transportation for that period of time. And again, you'll have to add about your your 3 months of US clinical experience. During that time, you might be in the state you desired, your family is there, or you might be in some other places. So those expenditure, I really cannot tell you like how much it's gonna cost, but I can give you a rough assumptions. It's gonna be over $10,000. So it is expensive. USMLE is expensive. You are dedicating your 3 years of valuable time to it, your 3 years of dedicated time, and you are spending more than $10,000 to it. And unfortunately, when people don't match, this cost is just gonna go like higher and higher. But there are positive things also out of it. So once you do get matched, your salary is gonna be a very, I would say, decent one. As an internal medicine resident, you will be earning something around $50 to $58,000 a year. So you will be pretty much in a state where you will be able to pay back your debts as well over your residency, or once you are done with your residency. And when you are a physician, you will be earning like a very good amount of money at that time. So you will be, even if you have like a debt of like $15,000 to $20,000, you will be able to pay it at that time. So as an internal medicine physician, you will be earning at least like around 240s. That's an average salary. So it will be like somewhere from $200,000 to $300,000. So you will be earning. And if you have to compare like how it would be with the other fields in the United States, I did find some other fields. So the average salary in the United States of people is like around $40,000 to $50,000, and other fields it would be somewhere around 150, and you would be somewhere around 250. So you have some positive things to be motivated as well. And other things that you should consider like for positive motivation is you will be practicing systematic and guideline-based practice, and you will be practicing with newer technology, newer medications. You will be involved in research if you are interested in it. You will get a lot of fellowship opportunities. You don't have to, for example, in Nepal, you'll have like 2 or 3 spots for one fellowship in one hospital, but here you will get a lot of opportunities for fellowship. If you desire to be, you will have a better lifestyle, you will be financially sound. And if you're someone who likes new places to travel around the world, so US would be something you should be planning to do it. Okay, so any questions, anything for me?
Thank you, Sumit. Thank you. It's really, really excellent. Excellent. Definitely, it's going to help them regarding the questions and answer we're going to do at the end of the sessions. Definitely, they would do have the questions. So at the end of the sessions, we'll discuss the questions and answer. Thank you again. Our next speaker is Dr. Prakash Karna, who is a PGY3 in pediatrics in New Jersey. So he's gonna discuss about once you come to US, what are the process, like how to develop your credentialing, how to make your credential strong, like getting LOR, research, and publications. So Dr. Prakash, please go ahead.
Thank you, Vijay. I'm not able to share my video though. It says the host has stopped it or something like that.
Yeah, they're gonna unmute you. Can you unmute him, please?
I'm unmuted. Okay. All right. I'm able to start the video. Let me start by sharing my screen. Let's see. Are you all able to see my screen?
Yes, as a confusion.
All right. Okay. So let's start. First of all, I would like to commend and congratulate all the members of Koshish Foundation for this great initiative that they have taken. You guys are really doing a great job. And at the same time, I would like to say thank you to all of them for providing me this opportunity to talk to all of you and share my USMLE experience. Without further ado, I would like to move to our topic for today, which is approach to USMLE and US residency. So how I see USMLE and how I think most of the people see USMLE is, USMLE is a journey. Everybody says it, right? So I see this journey in 4 different phases. Your first phase, when you prepare for your USMLE, staying in Nepal, prepare for step 1, step 2 CK, that's your first phase. Your second phase starts when you plan to come to the United States, where you sort out your travel arrangements, your visa issues and all. Third phase is when you come to the States and you prepare for your application and also what you do in between before you apply. That's your third phase. And fourth phase is your application and your interview and match cycle itself. So we heard about first 2 phases from earlier speakers. Now I'm going to talk to you about third phase, what to do once you come to the United States before you apply for your residency. So if you are coming here, all of you are coming here already to take the step to CS, right? Which can be taken only in the United States. There are 5 locations: Atlanta, Chicago, Houston, LA, and Philadelphia. Temporarily, this exam has been suspended, as you heard from Dr. Rajendra. It has been suspended until June 2021. But this is an unusual scenario going on right now. I'm sure the exam will resume. I am an eternal optimist. So I think the world will get back to normal. Maybe it will be a new normal, but it's gonna get back to normal, and then this exam will be resuming too. So how do you prepare for this exam? You have a lot of resources from Kaplan. You must be already using Kaplan for other steps as well. You can do first aid from Kaplan, lectures, videos, a lot of stuff from there. You have USMLE World, where you can get the resources as well. If you are here in person in United States, you can use workshops and practice exams in person at Kaplan. Now, note that these are all payment-based. You have to pay for those workshop and practice exams. If you can afford it, that's also another good resource. Next, you can make use of forums. USMLEforum.com is a very popular one. Next is Prep for Your USMLE too. That's another forum. In these forums, you'll find a lot of people posting their experiences, and you'll see a lot of resources there too. For step 2 CS, I also advise to have a study partner. It helps a lot. You'll have someone who can give you a feedback, how you are doing, and you can find a partner from United States itself. You can go to the USMLE forum, just post there that looking for a study partner for step 2 CS in particular area, wherever you are. I'm sure someone who is on the same boat as you is going to reply, and you will find a study partner. Or if there are other people who came along with you to do the USMLE, you can take help of them as well and have them as your study partner as well. Having a study partner really helps. I used myself. I had a guy from Nigeria who I partnered with during my CS exam. And this is one exam where international medical graduates, they have a lot of difficulties. The fail rates are higher in this exam compared to other theoretical exams. So this exam has to be taken seriously. But like the earlier speaker also said, exam has been postponed, and you have a different pathway to get ECFMG certification for 2021. Moving on, what else can you do to maximize your chances to get residency or to match? So there's something called US clinical experience. The programs rather want you to have some kind of US clinical experience that can come in form of observership, externship, or clerkship. Observership, as the name suggests, you go and observe. You don't do the physical exam and all, but externship is a hands-on experience where you're allowed to do a physical exam. Clerkship is just another name for rotations that to do in the United States. It's a third-year rotations for us in Nepal, or here the final year rotations for US medical students. So how do you get all these US clinical experiences? It can be self-directed. You can search on your own, or there are formal programs as well. How do you go and search yourself? There are local clinics and medical centers in in the area that you will be living, you can just go and walk into those clinics and request if they can allow you to shadow or observe. That's one way to get it. If you are in a bigger center or in a bigger cities, there will be hospitals or even residency programs in those areas. You can email the key person in those programs and hospitals and request for allowing you to do those observership and externship. It's not that all the time they will reply you with a positive answer, but you have to be perseverant and keep trying to get it. Next would be reaching out to the seniors, the people who have done in the past, your seniors or your friends who have done in the past. Reach out to them and see where they got their US clinical experience. That's another way to get it too. Networking, that helps a lot. I cannot emphasize more on that. That really helps a lot too. Now, formal programs, there are formal programs which, based on certain amount of payment, they do provide you this US clinical experience. I have posted a web link. The web link is from American Medical Association itself that lists common programs which provide this kind of experiences. All based, you apply them, they have certain eligibility criteria, you have to meet that criteria, and not everybody who applies will get the program as well. And they are expensive too, let me tell you. One of the program listed there, AmeriClerkship, that charges almost over $500 for a week of rotation, which comes to about $2,000 every month. So it's very expensive. They do provide you the experience. They will provide you, based on how you do, the letter of recommendation from US mentors as well. Even if you do seek on your own, you will get the letter of experience. So that's very important to get letter of experience from US mentors or US physician. So getting US clinical experience will help you familiarize yourself with the US system, will help you put something in your application that will make your application look strong. And lastly, it will help you secure those letter of recommendation too from the US mentors. So getting US clinical experience while you are here is very important. Next is research. Research is another thing that which can be added to your resume to maximize your chances. Now there are two kinds of researches, lab research and clinical research. Lab research, as the name suggests, you work in the lab. You run some kind of tests like PCR, but you don't work with the human subjects. Versus clinical research, where you do work with the human subjects. You, for example, one of the clinical research would be testing new medications, right? You may be part of that. Clinical research is considered better for maximizing your chances in US residency. But if you don't get one, it's better to get even lab research if you can secure one. Again, how do you find these opportunities? Same thing, again, self-directed search and emails. I would advise searching for these opportunities in big institutions like Harvard, Columbia, Cornell. Those institutions always have some kind of research going on throughout the year. You go to their websites, go to the research page, and find the persons who are involved in such kind of research and send them an email that you are interested to join their research. You may have to send emails to hundreds of people, and maybe you'll receive reply only from one or two. That's fine. You need just one or two to secure the position, right? So you have to be perseverant and you have to be sending lots and lots of emails if you want to secure the research position. Again, if you have connections, if you know people who have done research in the past, you reach out to them. Networking is again important in this sector too. Like observership and externship, there are formal programs which provide research based on application and certain payment. A couple of programs I have listed in this slide too. I think the slides will be shared with all of you in the end, so you can make use of all these links and the list that I have shared here. Next comes jobs. Now, who needs to do jobs, right? You have all come here to apply for residency. Why do we need to think about jobs? Not everyone who comes here is financially sound. I have met many aspirants who have come here who have not been able to even secure money for their step to CS exam, forget about rents and bills, right? So in order to sustain yourself in the United States, if you don't have financial backup, if you don't have enough financial support, or if you haven't saved enough money to sustain yourself here, you might end up working in some kind of jobs. Now, if you're coming on student visa, it's not legal to work in the United States. If you don't have visa issues, then you can work. But even with the no visas, people do work on cash basis. It's just like under the table. It's not legal to work on student visas. Now, if you don't have visa issues, you can do jobs. Jobs can be medical as well as non-medical.
One thing, Prakash, I'm sorry to interrupt you. I think this video gonna be placed on the YouTube, and this video might be watched by everyone. So those type of legal issues, I think we should not discuss.
So like I said, legal to work on student visas. If you have this, you can do jobs, medical and non-medical, both jobs are available. It's very difficult to secure medical jobs. Even for the smallest of the medical jobs or basic medical jobs like medical assistant or any nursing assistant, you do require certification and training. America, all jobs are certificate and training based. It's very difficult. Still, some people find those jobs like scribe, where physicians dictate their HNP and progress note, and you can just type in those notes for them. And there are jobs like clinical assistant in smaller clinics where you do the patient intake and take vitals. You can do those kind of job. Clinical documentation specialist where you just review medical records for inaccuracies. You can do that too. Most of the IMGs will end up doing non-medical jobs though. If they don't have any visa issues, you'll be surprised to see how many IMGs work here in convenient stores, malls, restaurants, or do Ubers. There are a lot of them who do all these kind of odd jobs to sustain themselves and to pay for their bills, even to pay for their exam fees. So the big question now, what if you don't match? I don't want to paint a pessimistic picture here, but the reality is there is substantial number of people who go unmatched, right? There is a data for you on the screen. This year, 61% of IMGs matched, which is a very encouraging data, in fact. It's 2.5% higher than 2019. And in fact, since 1990, this is the highest match percentage rate. So that's very encouraging data, but still there are almost 40% of people who have unmatched. What about them, right? So there are chances. It should be in the back of your mind too. Is there a plan B if you don't match? Now your plan A can be itself plan B. Your plan A was always to prepare for MLE and match, right? That can be your plan B too. You can go through the cycle again, go through all those things again, improve on your application, add some more observership, add research or publications if you don't have any. You can do that, but then comes the matter of financial resources. How are you going to sustain yourself with all this new cycle again? So you do need financial backup a lot, and you do need to rethink if you really want to go through all this tiring process again. The journey is tiring, but the rewards are very pleasing, let me tell you. And finally, emotional support. I cannot emphasize more on that. Emotional support is a must. Throughout this journey, I would say. The journey is really draining emotionally and physically both. You do need support of your family, friends, peers who are on the same boat as you. You need to keep yourself connected. It's very easy to get isolated during this long journey. So make sure that you have a lot of emotional support in this journey. And there are a lot to share, but we have time constraints. So I would like to end my part of the talk here. And again, good luck to all the aspirants. And passing over to the next speaker. Thank you all for listening, guys.
Thank you so much, Prakash. I would think this gonna be a great help for the USMLE aspirants, and as all the USMLE aspirants, they need to concentrate on a couple of steps. One is a score, definitely. Second one is visa, credentialing, and presentation. The credential part, which is most important. I know everybody work very hard. Most of them get a great score. The next step you need to work on is the credentialing. And then Prakash put the lots of names of the various institutions where you can get clerkship or observership, internship, whatever. Now, everybody coming to US, they are doing that, and most of them are aware and they know where the places are. They can give you a good letter of recommendations, and that is the most important. And other thing, you also need to work in Nepal to try to do as many as presentation, case presentation, even and be members of multiple institutions. That will help you to get the visa. And the US, mainly they try to focus in how much time you are spending in the community, how much useful you are for the community. That's what they look for. And you have to find a place where you can be a member, where can you work, even some NGO, INGO, various other hospitals, some community work, and those will help you to make your credential strong, and they will see like, yeah, you are participating in all those steps. Here also, the various medical students or who they are doing undergraduations, they do come to our emergency, they work as a clerk, they clean the bed, they do some nursing stuff. So please be prepared for that one also, and you can do in Nepal also. That will show you are really dedicated for the community and you are helping the patients in all the way. Thank you, Prakash, again for your nice presentations. And our next speaker is Dr. Apurwa Prasad. She is very experienced, very nice girl, very hardworking. She is doing internal medicine residency in PGY2 in St. Joseph Hospital, Chicago. So she's going to talk about various application process, how to apply to the program, what program to apply, what specialty you are going to apply. So Dr. Apurva, please go ahead.
Oh, can you guys hear me? Hi everyone, this is Apurva. I'm a PGY2. I am working as an internal medicine resident at St. Joseph Hospital here in Chicago. I'm going to be talking about the application process and interview season in basic. So I want to know first, like, how many of you are actually, can you guys see my screen? Okay.
Yes, we can see.
Okay, so how many of you guys are actually planning to apply this year? Let's see. Okay, anyway, so the application process, the first things first, after you're done with your CS, I think that's the best time to start working on your application. The application process first starts with taking the ERAS token. This is where you'll be mostly looking at your, this is the website that actually works on the application. ERAS tokens start from July. I'm not sure for this year. It costs about $125, which you get through the ECMG website. After the ERAS token, you're allowed to start working on your ERAS application. I'm going to go briefly about the ERAS application in a bit, but most important about your whole application is going to be the application itself, letter of recommendation, personal statement, and proof checking the whole application multiple of times. So coming to the ERAS application, you have your score by the time you're going to apply, which is around September. I think it's October 21st this year where the applications are going to be released. So by the time you're applying, you already have your scores. So your scores are, whenever a program is selecting residents or selecting interview applicants, they have filters, right? They have filters that they can put at step 1, step 2, and step 3. Let's say a program puts a filter for step 1 and step 2 at 240, and they put a filter that the step the step to CS has to be the first attempt. So imagine how many other people who have scores above 240. It's going to be like thousands, right? After that, what really stands out is your application. That's how they will look at it. That's how they'll see if this person's a good fit for the program. So your application says a lot and does a lot. And try to be very concise and precise while writing your application. Long paragraphs containing long words, long descriptions isn't really helpful. Try to include everything that's pertinent, but has to be short and structured sentences. The application also has subheadings that talk about awards and hobbies. Awards, any award, anything that you have done in your medical school, even if it's like a basketball championship that you won, or it's like a debate competition, it's an essay writing, any of that you did during your med school is always good to write. This shows that you're just not a nerd and you have another personality to yourself as well. Your hobbies, there's a whole section on hobbies. And let me tell you, during my whole application, half the time I was talking about my hobbies. That's something they really, really want to look at. They want to see what you're interested in. If you're good at singing, if you're good at dancing, if you're good at writing, if you're a blogger, put those stuffs out. For me, I put my blog in my hobbies. I put the link to my blog, and a lot of interviews were asking, actually went to my blog, read my blog, and were asking me about it. So that becomes a topic of a conversation there, and so those things are pretty important. Any research project that you've done, even if it's in a small journal, it's not PubMed Index. If it's PubMed Index, that's like the cream. But if it's anywhere, anything you've written as a research project, it could be a case presentation, it could be an original article, anything. Do not forget to mention that. That shows you're interested, that you work hard, and you have a base to research. Even if it's just the community medicine projects that you've done through your medical school, even if it's just that, make sure to write those down. Any volunteer work or social work that you've done throughout your medical school or after medical school, a lot of our medical schools have smaller organizations or platforms that we're always working with, like blood donations or driving health camps or any of those. Put that in. It just means you're not just a nerd, and you also have a social aspect to you, and then that shows a lot about your personality as well. And this is a pro tip. While you're putting your application, they ask for contact details. If you have somebody in New York, New Jersey, Baltimore, or Chicago, try putting their addresses in your contact details. It's very well known, people who have New York addresses, they get a lot of interviews from New York, and New York has a lot of ING-friendly hospitals, so you will get a lot of interviews from that area. Same with Baltimore. Baltimore seeks out residents from Baltimore, around the Baltimore area as well. Chicago, not as much, but Chicago, especially during winters when so this time it's going to be a virtual interview, but when it's not a virtual interview, a lot of people who are in Chicago, during winters, it's cold and windy in Chicago, and there's a lot of cancellations. So the program seeks out people who are around them, who can come by in a day's notice and give their interviews. So putting these addresses really helps you in getting interviews. So letter of recommendations. Traditionally, the programs require 4 letter of recommendations. Some programs are okay with just 3. And a lot of questions that I eventually get from people is, oh, how much United States LOR do you recommend? How much should I put out that? And how much of the home LOR? I put out 3 US LORs and 1 home LOR, but if you just have 2 United States LOR, which are a basic, generic, mediocre LOR, and you have very good 2 home LORs that are personalized, that are from your professors who know you well and have written you a good LOR, I would recommend putting 2 mediocre US LORs and 2 home LORs. The thing about the home LORs are, like, programs know that you've been at your medical school for like 5 years, and those people know you better than people who have assessed you in 1 month. However, the 1 month is important because the person who's writing the LOR for that 1 month can have a basic idea as how you're going to blend into the US system. So that's important as well. It's important to put US LORs, but if you don't have a US LOR, or you're having shots on, if you're shot on the US LORs, Make sure your home LORs are very personalized. They speak volumes about you. And home LORs are written by your own professors, right? You've known them for years, and you can always request them to put the home LORs. There's another thing, something called waived and unwaived LORs. So the waived LOR means you've never seen it. You don't know what's been written on that. You don't know what the writer is writing about you. And those are the preferred ones. So your professors or whoever is assessing you will directly submit it to the ERAS portal. And that's all. You don't know what's happening. And programs prefer that, right? And unwaived LORs are the ones that you know, and most likely you're uploading them. You know what's been written at it. So that is some kind of bias. So they don't get preferred, but if you've got nothing and if there's an unwaived LOR, go for it. Something's better than nothing at that point. Some LOR, some programs do want an LOR from your head of Department of Medicine or the department head at any state. And plus, I think a county here in Chicago wants an LOR from your head of department. So make sure that you have, when you come here, you have an home LOR written by your head of department just in case. If it's a generic LOR, it doesn't matter, but that is a criteria for a lot of programs. So make sure you have that done before you come here. Your personal statement. Your personal statement is an essay that shows the most of your personality. It's the perfect place where you can talk about things that are not medicine and things that inspire you. Talk about what got you into medicine, but don't talk about it too much because most people write about this when they get into med school, and programs have heard about this and have listened to this multiple times. Write the small stuff about why you got into medicine, but write more about what you did during medical school. How was your journey like? What things inspired you? What got you into whatever specialty you're applying? If you're applying to internal medicine or psychiatry or pediatrics, any of those, tell the program what got inspired to like getting into that specialty. It could be your patient relations, it could be what your attendings told you, what your professors told you, whatever it is. Make it very personalized, and it's okay if you wanna include your anecdotes about what a patient said to you and all of that. Make it very personalized. It's the ways to personalize it the most. Always save the first draft of your personal statement. This is because it's raw, it's what you want to tell them, and it's your personal feelings. It's the first time you're writing it, right? So always save your first draft and then start editing it out. And something I learned from my own experience is do not send it to a lot of people. Give it to people who know you and to some strangers. Do not send it to a lot of people, because what happens is when you send it to a lot of people, they feel like pressurized, or they have a sense of duty that they need to edit it. And everybody edits it to a point that your LOR seems like a generic essay and has not a lot of feelings, because not everybody knows what you wanted to write in the first place. So once you've edited it all out, go back to your first draft and see, like, did you actually wanted, is the message actually conveyed? Is that what you first wanted to try to say? So always go back and look at your essay and see if that personal touch is still there after all the editing. This is also a great place to explain any shortcomings or red flags that you have in your application. Let's say you have a step 1 CS attempt, or there is a gap of where you haven't worked, or there's just a resume gap. Explain all of this with a very progressive mentality. Say, admit what you have, what the red flag is, and see what you've done about it. Do not give excuses. Do not say, oh, this didn't work out or that didn't work out. That's a victim mentality, right? What you have to do is admit to your shortcomings, admit to your red flags, and say how you've worked on it, how you've come further from it, how you've bettered yourself from the failure or the red flag that you have in your application. And then like in bottom line, it is your story, it is your personal story, and your story is unique to you. There is nobody else who has your story. So make it your own story. And like I said, always refer back to your first draft and see that is that personal touch is there, because it's a personal statement. It's not a generic application process, right? So proof checking. Make sure there's no plagiarism. Make sure you're not copying from anybody else. Try to use websites that check on this. Make sure the codes that you're using for your personal statement, especially if you're using a code, make sure you quote that person. Don't write stuff, do not copy stuff out of the internet and make it your. People find about it, and that's just lying on your application. Do not do it. Do not lie on your application as well. Do not lie about things you haven't done. Do not lie about scores. Do not lie about anything. If they find out you've lied, that's end game at this point. Check and double check for spelling mistakes. That's a pet peeve for a lot of programs. Check and double check for grammar mistakes. If you want your friends to look through it, if you want your mentors to look through it, give it to them and see if they can find any mistakes, because sometimes the application is sometimes it posts about 15 pages, and it's not always possible for you yourself to proof check it all the time. So it's okay to discuss with your friends and discuss with people if you discuss with people to check your application, but not your personal statement though. I know a lot of us like study in groups, and we have friends who are doing the same thing. So it's always okay to talk to your friends about what they're putting in their application, if there's anything that you could improve on, and all of that. And your application, make sure your NRMT, your AAMC ID, and your email ID is correct, and your address is correct as well. And do put on a working phone number. I'll come to that in a bit, but put on a working phone number, a US phone number, while you're doing while you're submitting the application. Talking about program selection, the biggest source to look into a program that you want to apply is FRIDA. It has all the programs listed, and they have a lot of filters about scores. They have filters through states. They have filters through program specialty, and also it's upon you about what program specialty you want to apply. I think this was mentioned earlier. There are some specialties that's easier to get into than the others. Most popular ones are internal medicine, pediatrics, and psychiatry, and neurology as well. So psychiatry and neurology needs to have a really strong base that connects to that specialty. They do look for researchers in that area. They look at what you've done in the past to say that you're actually interested into psychiatry and neurology, not as much as internal medicine. Their term IMG friendly, I think you guys must have heard it quite often. IMG friendly means how much international graduates is the program taking on their is taking in their whole program. Like if the first years are like about 20, how many of them are actually international medical graduates? And this you can find through FRIDA. FRIDA lists this out very well. They'll show you about 99% IMG friendly, or they'll show you 0% IMG friendly. It's always better to apply into IMG friendly programs. No matter what your scores are, some people might have really, really good scores, but you need to know that some programs are just not cut out for them. So they are not friendly to international medical graduates. And if you want to apply to that program, you have to weigh out the risk, weigh out the con of putting into money into it, because every program is $25. So you have to cut out the weed in that way. So filter out your programs, looking at, so if your first base is after you've looked at all the IMG friendly programs and you've selected your specialty, you'll get about 100 to 200 programs. How do you cut out on that? So whenever they ask for criteria like USD, if they have electives and you've not done an elective, it's okay to cut that off. Look at score cutoffs. A lot of programs have, like, they say we'll only take people over 230 scores, or we'll only take people over 240 scores. And if you're not meeting that criteria, cut that program off. Most likely they're gonna put a filter out there, and they're not gonna interview you. So do not put your money into all of that. And look at attempts. Some people have CS attempts, or they have, even for step 1 and step 2, they want the first attempts. So look at filter those programs out as well. Research through the website. FRIDA doesn't give you everything, but sometimes you won't get the whole picture out of FRIDA. So always look into the programs, go to their websites, and the things to look into their websites is who are the current residents. So if you see a lot of current residents who are from India, Pakistan, or Nepal, especially look for residents if there are residents from Nepal, especially since we're talking to Nepali students right now. So look at if they have taken any residents in the past who are from Nepal. that gives a positive message that they are known, they know Nepali residents, they know how system in Nepal works, they're familiar with universities in Nepal, and they're friendly towards it. So definitely apply to those programs. And when you're looking through the program, look at the program's trends, look at what the emphasis on, what they want from you, because these are stuffs you can talk about in the interviews if you're offered one. And look at the visa offered, look at H1 and J1 visas, and then you can prioritize your way through it. And also look at, sometimes you might look at a program and you think it's IMG friendly and you like all of it, then you'll realize that they actually do not offer visa to students. And these are people who might be IMG friendly, might also be students from the United States who have studied in the Caribbean, and they have a green card or a US citizen. So that might be a confounding factor. So always look if they're offering for visas, and then cut out your program selection at that. I think somebody mentioned about 120 programs is good enough to apply. But that depends upon you, how many specialties you're applying. Oh, I didn't mention that family medicine is also one of those areas that people do tend to apply into. So if you're applying to internal medicine and family medicine both, so obviously your programs are gonna be of a higher number. So these are the things you can like look at and filter things out and have a concise list of places you want to apply. Also, always apply to places where they have Nepali residents. That's the key, because they know how system in Nepal works. They're accustomed to it, and they might likely offer you an interview if you meet their criteria. So now the interview season, right? After you've applied and you've submitted your application, generally it's September 15th, but I think it's October 21st this year. Have to be very patient. It takes them about a month. It'll take you about a month before you start taking interviews. And you know, you're very anxious this time. You will be looking at your emails, but it's okay to be anxious, but just have patience. It will come true. It's gonna be late, but it will come true. While you're waiting, I generally advise people to give their step 3 because that helps in getting H1 visa, but that's on you. If you're not comfortable in giving your step 3 in a short duration of time, that's on you. So most interviews come through ERAS. That's the portal I was talking about for your application. Most interviews come through ERAS. You will get an email notification that the interview has been extended to you. Be very vigilant with your emails and be very vigilant in checking the ERAS website, because especially if you're back in Nepal and you're in Nepal, they will send interviews during the nighttime. And most times they have very limited spots, and you have to RSVP as soon as possible that you've accepted the interview. You might lose out an interview just because you applied late to them. Sometimes they do come through phone calls as well. I got an interview over a phone call where they asked me to come the very next day or the second next day. So you have to be okay with, you have to have a good working phone. You have to have good network and be vigilant about the phone calls as well. Sometimes you will see interviews coming through third-party websites like Interview Broker. Do not think that's spam. Always check those out and see if it's coming from a program that you know of. And like I said, frequently check your phones and emails. And if you're traveling, like let's say if you're flying next year, you most likely will be traveling to interviews, and you're in air flights or you're in a bus in a remote area. Always ask a friend or family you trust to look at your emails and give them the dates that you're okay with to take care of your interviews. Because like I said, people have missed out chances on their interviews just because they replied late to them. So while you're waiting for interviews and you're being anxious, it's better to prepare for interviews. Few questions that they always do ask. The first question actually they always ask is, tell me about yourself. Tell me about yourself is like an elevator pitch, right? It has to be about a minute long, but you have to include everything pertinent about yourself. And this is not oh, I am a very kind-hearted person, or I like singing and dancing. That's not what telling about yourself is. Telling about yourself is where you come from, what medical school you went to, what you've done in the past few years, what have you been doing in the past few months, and then you can add a personal touch to it, saying that I'm a very passionate person, or this and that, and these are my interests. But most of you tell me about yourself, it has to be professionally related and not personally related. A line or two at the end is good. This website has 40 questions, AMC 40 questions. These are the frequently asked questions. And I kind of this can help me a lot while I was preparing for my interview application. So you can go through all the questions on that. There's about 40, and it's better to prepare every single of them because they are actually very frequently asked, and it helped me a lot during my interview preparation. So behavioral questions, these are different from the AMC 40 questions. These questions are mostly like, oh, well, where do you see yourself in 5 years? Well, what is your take on research and all of this? The behavioral questions are very tricky. These are questions which are mostly ethical. They'll put you in a place or in a situation and ask how you react to it. Questions like, are you a team leader or are you a team player? Or tell me about the time you have failed and how did you overcome it? Or what would you do if somebody, or like ethical questions, like somebody is like a patient is not doing well and they cannot answer for themselves and you have to make decisions. How would you make decisions for that patient? What would go through your mind? And things like that. So behavioral questions are very tricky. There is an USMLE group on Facebook and interview preparation group on Facebook, and they do post a lot of behavioral questions that you can go through. So mastering your behavioral questions is also very important. Other questions like, where do you still see yourself in 5 years? This is a place where you can be very concrete and say, oh, I want to do fellowship and I want to do fellowship in this specialty, and this is where I see yourself in 5 years. Or you could also say, I am not sure. I'm ready to explore this possibility while I'm doing my residency, but I do know that I want to pursue a fellowship or I want to do certain years working as a hospitalist and then pursue a fellowship. You could be vague, but if you have a concrete answer and if you know what you're doing, better have an explanation about why you think so. If you're saying I'm going to be interested in a fellowship in cardiology, let them know why you think you're interested in cardiology. And also this time, also look at where you're interviewing at. If you're interviewing at a community program where a lot of people are going to hospitalist positions, if you state you're into a very competitive fellowship, they might think that you might not be a good fit because you have a higher expectation of the program, and the program might not be able to fulfill your expectations. And why United States? A lot of this is a question that you can break or make. You do not state financial reasons, do not state incentive gains. Tell them why United States, in a sense that you're looking for a better educational opportunity, you're trying to learn something more than what your own home country offers, and things like that. Do not state financial or incentive reasons in this question. The interview day. So most likely, I heard my program is going to help do this virtual this year. So it's better to have a good internet connection. I know back in Nepal, internet connections can be flaky, but make sure you get a good one. Also means that you will have to do a lot of, if you're going to stay home in Nepal and apply from Nepal, it also means you'll have to do it during night. So be prepared for that. Always have a neutral background to you. Even if it's a virtual interview, please dress well. Please wear a have a formal outfit for that. Try to be relaxed. That means be prepared for your interviews beforehand. If you're prepared, you know you won't be anxious and you'll be relaxed. And smile as often as you can. Even if it's virtual, just smile. That smile works a lot of wonders, let me tell you that. But if you're doing it in person, if you're applying next year, always have a good night's sleep, because interviews, sometimes you have to go to interviews at 7 o'clock in the morning, 6 o'clock in the morning. That means you're also going to be traveling to that place. It can take about a half an hour. It can take about an hour to go to that place. So have a good night's sleep, be awake, be fresh in the morning, dress well. It matters a lot. Iron your shirts. Do not come in comfy shirts. Do not come in shoes that are not comfortable to you. And interviews happen during winter time, so make sure you dress for the winter as well. Dress for, like, you have a good coat, you have an umbrella, and you're ready to face the challenges of winter as well. Always arrive on time. Nobody likes waiting. You just put a bad impression if you're making the program wait for you. So always arrive on time. And from the time you enter the program building or even outside the program building, please be nice to everyone. Everyone you see, try to be nice to them, try to smile to them, be polite. Do not be rude to anyone, because if anybody is actually judging you there, or the word travels to the program, it's really gonna look bad at you. And also be very nice to the fellow applicants you meet, because a lot of the programs are also assessing how you interact with other people. Do not boast about your scores. If you have good scores, do not boast about the electives you've done. Just be very subtle, be humble, be polite, even to the fellow applicants who are with you. And asking the right questions to the right people. A lot of time, not a lot of time, in the US, it's very encouraged that you ask questions, but you need to know what question you're asking to the people. For program administration, like the program director, do not ask questions like, oh, what time does our shift end? What time can I go home? What is my vacation time? Those are not the things you ask to the program director. Ask those things to the people who's giving you the tour, or who are the fellow residents there, who are in a casual lunch with you, or if you have an interview dinner to go to, talk about those there. Do not talk during the actual interview to your chief residents or your program directors. For your program directors and chief residents, you can ask questions like, what are my fellowship opportunities? What are the expectations you have from residents coming to your program? How do you think somebody like me coming from an international country will blend into this program? Do you think I have any challenges to face? Those are the questions you ask to your program directors and your chief residents. But to people like your fellow people who are there already, you can ask about the food, ask about cafeteria, ask about what the lodgings are, how expensive it is to live in that area. Those are the things that you have to ask the people around you. Do not regurgitate your prepared answers. I know I've asked you to prepare well for it, but do not memorize your answers. That looks very robotic. That does not look authentic. Please be casual, be spontaneous. It's okay if you are hit by a curveball and you have to think about a question for a second, and you have to say, oh, let me think about it a second, and that's a really good question. I'll have to think about it for a moment. Those things are okay to say. Nobody's going to judge you on that, but do not blurt out your answers or regurgitate your answers and be robotic about it. Like I said, talk about your hobbies. If you have a girlfriend, if you have a boyfriend, if you have a wife, talk about them, because that just means they're looking at somebody who's social, who's okay, who is collegial, who work with others, having any trouble. So talk about those things. They already know your scores. They already know you're qualified. What they're really looking at in interviews is somebody they can spend the next 3 years of their residency without having any troubles, somebody who's going to be friendly with others, who work as a team, and will not cause the program any problems. That's what they're looking at during their interviews. So that's a chance. Be likable in that way. Do not, also please, if I'm saying be likable, do not fake things. Just be really polite, humble, friendly, and just somebody who people would like to have fun with. And like I said, smile as much as you can. Smile to anybody you see. That just does work wonders. And there is something one of my seniors told me while I was doing interviews, is treat every interview as your only interview. You might have 15 or 18 interviews to go to, but remember, you only need one interview to match. And if you treat every single one as your only interview, you will give your best out there. And that's the way to go. So post-interview, after you've finished your interview, come back and reflect on how it went. If you realize any mistakes, if you saw that you did any blunders, or think about things that you did right, always think about it and put it into your next interview. Send a thank you note to the program directors, the people who interviewed you. You can write a note and send it by postcard. That's good if you have the time to do it and you have the resources to do it. That's well and good. But if you're writing an email, that's fine as well. But personalize it. Talk about things that they asked you during the interview, your experience, or something, a conversation that you had, and you can mention that, oh, that was really fun to talk about. Personalize it so that they recognize you, they have a face to your email, and they will remember you. And after the interview, if you have any updates regarding scores or your visa status. Some people might be on EAD and they might get a green card, or your visa status is changing. If there's any changes to your application, it's okay to send updates after the interview as well. That keeps them in the loop and might increase your chances to match there. And do not be anxious if you don't hear back from the program after the interview. Some programs reply a generic answer, some reply very encouraging answer, or some just don't reply, and that's okay. Not every program is the same. And even if you hear back from the program, if it's a very generic basic email, that's okay. That really doesn't say much. So do not get anxious over it. And while you're choosing the place after all the interviews, it's better to write your experiences down after you came back to the interview, what you thought about the program, because choose a place where you yourself see you for the next 3 years. Because remember, whenever you're matching or you're putting your match rank list, it favors the applicant. It starts from what the applicant wants to match at. So always put the programs first that you yourself are comfortable at, where you yourself see it for the next 3 years. While making your rank list, make sure you have all the NRMD codes, the right NRMD codes, and just enjoy and trust the process. It's a very long, frustrating journey, but I tell you, it's worth it when you get through it. And that's all from me. Any questions?
Thank you so much, Apurva. It's really nice, and I hope audience are enjoying it. I know it's getting longer than expected. So I have a last speaker, Dr. Sumit Karna, who is a second year resident in Bronx, New York. So I would like to request him to give a small overview about specialty and subspecialty, like which specialty to choose and further study. Dr. Sumit, are you ready?
Yes, I am. Thank you so much, Mr. Dr. Vijay. Hello, everyone. So I'm Sumit Karna. I'm a second year internal medicine resident at Bronx Care Hospital Center in Bronx, New York. So I'm going to give you a brief overview of what specialties do that IMGs actually aim for, and what specialties are possible for them. So the highest number of seats in the residency that you can have is for internal medicine in any hospital. So that's why most of the people, they apply for internal medicine, because after internal medicine they have chances for fellowships like cardiology, nephrology, and sometimes people even change specialties from internal medicine, like from internal medicine to anesthesia and dermatology and everything. So, and other than internal medicine, actually we have pediatrics, we have family medicine, we have neurology. I mean, those programs are actually easier for IMGs to get into, and also psychiatry. And actually many people think that it's impossible to get surgical specialties, and many doctors, they actually want to become surgeons. And this year many of the applicants from Nepal actually matched into surgery. So what do you have to do in order to match into more competitive specialties? So the thing is, always high scores are always very important. And other than high scores, what they look for is research. How you have developed yourself in that field over the past few years, or over the past few months that you have spent in the United States. For example, if you have done clerkship or any externship in surgery, or sometimes in radiology, like they actually prefer that. And for that, it's not very difficult to get into those kind of externships or those kind of observerships as well. Because the thing is, as I mentioned in one of the presentations, that you have to send emails. Keep sending emails to hundreds of mentors. Tell them that you need observership or externship in surgery, in radiology, or any of the competitive fields that you want to get into. And that is actually going to change your path of USMLE, because most of the people, they keep internal medicine, pediatrics as a backup. when they apply for competitive specialties, but they do get into surgery when they apply for the extensives and everything. So the thing is, we have something called as preliminary year and a categorical year. So a categorical year is something that is, for example, if a surgery residency is 5 years, then a categorical residency means that you are going to complete your entire residency, 5 years of residency from the same institution. And preliminary means it's like just 1 year of residency that you need to do before joining any other residency, like surgery or even like anesthesia, radiology, even dermatology. So preliminary years are usually medical residencies. Sometimes it's surgery too. So some people they initially aim for just for a preliminary year, and then again reapply, and then they go for the categorical year. So that's how they go step by step. And another thing, so other than the specialties that you need to focus is build your contacts. So whenever if you know somebody who is doing a residency in that field, always try to keep in touch with them and try to get their experience. So because I'm doing a residency in internal medicine, my journey was not very difficult, not very easy too. So I'll just give you a brief on what I did actually. I graduated in 2015 from BPKIHS, and after that I had to do a 2 year of compulsory bond for the government, and after that I started taking my exams. So I took my exam in December 2017, step 1, and May 2018, step 2, CK, and in June I took my step 2 CS. After that, I had no idea of any observerships, externships, or anything. And I think most of you are on that page right now. And what I did was, one of my friends found out a small clinic in New York that was offering observerships to everybody. And that's not a good thing actually, because you'll be like 30 people doing observership under a single mentor. So that means that you're not going to learn a lot, and the LOR that you're going to get is not very personalized. But still, because I had no option, I did that. And after that, because I needed a second LOR, usually the programs prefer 2 LORs. So I had 2 US LORs. So I had to find out another spot for observership. So what I did was, I used to just Google up clinics around me. I used to go clinic to clinic, like just asking them if they have any observerships. I know that sounds like really difficult to do, but actually I did that. And luckily I found one. And right now, like I was, I think the first Nepalese who did observership in that clinic. And after that, like a lot of Nepalese have been doing, like it's mostly Nepalese right now who are doing their observerships over there. So you have to work by yourself, like just not rely on other people. So because what I did was go from clinic to clinic. So if you are very desperate, you can actually find something. That's what I mean. And of course, whenever you are confused and you have any questions regarding such kind of observations, where to get it, you can always ask questions to us. I can share my email address later on in the group message, and you can actually email me any of your questions and everything. And right now, I think we are already getting late. If you have any questions right now, you can always throw it to us. Thank you.
Thank you, Sumit. And I'm sorry to cutting down your time.
Yeah, it's
I think
okay.
the presentation is going on unexpectedly long, and I think it's already 9 o'clock. I think 9 o'clock or 9:30 in Nepal. So now I would like request audience to ask questions. I think Siddharth is collecting the questions, and Siddharth gonna ask the questions. So whoever feel comfortable answering those questions, please take and go ahead.
Sir, I think Dr. Gopal Dai will be asking all the questions.
I think Gopal, I think he has some
Hello.
internet. That's what I was
I
informed. Oh,
am
great.
here,
Okay,
and
great.
I can see that the questions in the chat box has been answered, and there are 2 questions remaining in the chat box.
Okay, great. What is the questions? Ask. Just can you read it loud so the speakers will listen and they can answer.
One question is about the statement of the needs. They have messaged me personally, privately, and they are asking that the Nepal government has released a statement of need, which will prevent them from getting visa and getting matched to the USA. And I can forward that paper as well. So
Okay.
is it has any impact on getting visa or something else?
Does anybody has experience about that
Yeah, I think
question?
I can answer. Actually, while I was applying for the visa, it was like a bulging issue, but eventually they gave the statement of need to everybody. They're saying they have few clauses like if you are doing a residency in some kind of field which is not available in Nepal, but like most of the residencies they are already there in Nepal, but still they give the statement of need to those people who are doing the residencies. And they also have a clause that they have to come back after completing the residency. But the rules in Nepal, they keep changing every year, not even every year, like 10 times a year. So please don't think that you're not going to get a visa because you cannot get a statement of need. They will give it to you eventually. It's just the health ministry that keeps changing rules and everything. Even this year, like a lot of people, they came on J1 visa and the statement of need was not an issue.
Okay.
They eventually
So
got the statement.
this statement of need is only for the
J1 visa.
medical doctor who went through the Ministry of Education or the private
No. Statement of need is for those who are coming to United States for residency on a J1 visa. So J1
okay.
visa is actually, it means that it is a student exchange visa. So that's why student exchange means that, for example, Nepal sends somebody to study some kind of subject and they have to come back after completing that study. And H1 visa, which I'm on, is like a worker's visa, which doesn't need a statement of need. But for that, you have to take your step 3 exam, as earlier said, and you can qualify for that. But if the program offers H1 visa, only then. So J1 visa is offered by most of the programs, but H1 visa is offered only by limited number of programs. And yeah, and as I said, like it's the statement of need is only an issue for J1 visa, but even like this year, they like keep changing rules, and it's not been an issue when they actually apply for the statement of need.
Okay, great. I think he answered it well, and if any next questions, please.
I think, sorry, yeah, I saw a question regarding pre-match. So I would like to answer that because I'm in a pre-match program. So just a short thing. So pre-match means that you go for an interview to a hospital which offers only pre-match. So either the hospital offers a pre-match or a match. So in a pre-match program, they'll offer you the position right after your interview. Maybe the same day, maybe the next day, maybe in a couple of weeks or a month. But they will offer it before the match. Okay, so we are giving you this position. You either you take this position and cancel all other interviews and don't go to the match program, or if you reject this, then you can go to other programs, or like as usual, you can continue with the match cycle. So they give you that option. So actually, where my program I interviewed, this was my first interview here, and they offered me the position 2 weeks later. And I had a few more interviews, and I thought that it would be best to take the pre-match because I was getting a residency. And although it was a pretty notorious this is a pretty notorious program because it's very, very busy. And yes, it's actually busy. So that's the reason like many people were not taking the pre-match, but it's fine because in Nepal anyway, the programs are always busy. And here in comparison to Nepal, it's nothing actually. So
Yeah.
I took the pre-match, and for me it was a better choice. But it depends on the people, like what kind of program they are aiming for, like a community program or a university program. Because university programs, they don't offer pre-match. But few community programs, mostly in New York and some in Chicago, they offer pre-match positions.
Okay, thank you, Prakash. Thank you. Sorry, thank you, Sumit. Any other questions?
I just saw a question that is OET compulsory for this year application? So OET is something replaced for the CS. So you must have to go through OET to get ECFMG certified. So that is compulsory for this year, and you can do it in Nepal as well.
Okay, thank you, Rajendra. Any other questions?
There is a last question to Dr. Sumit Karna. In the chat box, the question is already there. Do applying for the preliminary affect categorical match surgery? Is it good to go for preliminary match? Does it increases the probability of matching for next year?
Yes,
Sumit.
actually, a preliminary year is also a proper residency. So usually what we think is preliminary year is the first year of a residency. After that, you start second year of either surgery or anesthesia or something. So, but most people, they from Nepal, they are actually aiming for surgery when they apply for prelim. Or some people, just because they think that they are not going to match, so they apply for prelim, so that they can just get 1 year of residency here. So, most of the time they actually get a second year of residency. But since after the pre-match, you don't have anything. I mean, it's not that you have already a second year of residency fixed. So you have to apply for a second year of residency, and there are not many vacant spots for that. So, and also there is a visa issue that they usually it's a J1 visa, and they have to continue with that. And yes, what happens is, for example, if you are on a prelim program right now, and for some reason you don't get a position next year, then you'd be jobless actually. You have to go back and again apply. But the positive thing is 1 year of residency is better than any clinical experience, any research experience or anything. So maybe you might have to lose a year later on, but that is always a positive point because you have done a residency in the United States. Even if it's 1 year, that's very valuable. So that is something when you think your chances are low, you accept a prelim offer.
I just wanted to, hello, Rajendra, you're speaking, but just wanted to add, so some preliminary program matching, they also require you, or even if you match in a categorical position in some programs like neurology or anesthesia,
yes.
They require you that you have a preliminary position beforehand.
Yes.
Some programs just offer categorical position in anesthesia or neuro or surgery, but
yeah,
they still need to have the preliminary position. But they're still a resident.
There's one thing I wanted to add, like if you are going for preliminary 1 year on J1 visa, so that J1 visa is basically sponsored by ECFMG. So if you are doing first year, 1 year preliminary on J1 and you are applying for match and you are getting match on J1 again, then ECFMG is not going to sponsor you again. So ECFMG is only going to sponsor you J1 just for once. So that is also something you need to consider.
But
also, okay, sorry, go ahead. Who's talking?
What I was thinking, like the good news is a few times the program you can match in preliminary, prelim year, they will let you continue as a second year also. I have seen a couple of friends who join as a prelim year and they let you continue as a second year, or as Sumit was saying, it will be easier for you to join as a second year even in the other programs. There might be some visa issues, but I think the chances, if you have a less chances to get matched in any program, I think it's better to consider rather than just waiting 1 year. It will help you financially, it will help you get credentialed. and you get an training also. So I think if you are thinking you don't have a good chance, I think it's worth it to consider.
One thing just wanted to mention for the applicants this year, which is very important, all the interviews will be virtual, and most of the program directors, I was talking to a couple of them, will actually consider if you know someone, and if you're applying in a program, and if you know someone in that program, your friends, so they will highly value the recommendation from anyone that you actually know, because it will be all virtual. So they would like to know a person or take a person or a candidate that they have some kind of knowledge about. So try to get in touch with your senior or whoever you know from your medical college or applicants or friends. So for this year, for this season, actually, we don't know about the future.
So I think it's a good chance also, right? Rather than most of the time when you go to program for interview, we get anxious. We have some, because we have never faced this type of scenarios. So I think it will be better and I feel more confident in virtual interview rather than in-person interview. So I think it's a good for you guys.
There is a question about the year of graduation. I just want to give a brief idea about it. So usually what happens, there are few usually under 5 year of graduation is fine, but many of the programs will mention like you have to be you must be within 3 years of graduation. So there is always a filter. So if you are applying, if you are having 5 years of graduation and you are applying to a program who is already mentioning that you have to be graduated within 3 years, then there is no point applying in that kind of program. So the more older graduates, the chances definitely gets decreased, but that is not just the end. So there are other things. If you have research research publications, many research papers, if you have many LORs, better LORs, then that will definitely will help. But it's better to be within 5 years of graduation. The other question was, should I give OET for the next 2023 and 24? I will suggest not to give OET for 23-24 right now, because everything is changing. The CS is only suspended for 12 to 18 months from now. So they might resume CS later on, and they might announce that OET is not valid for now. So let's not do that right now. And there's a better way to get all these announcements. I will suggest to have a Twitter account and get USMLE page, ECFMG, AAMC, like the important things, and have a notification on. So whatever they did, the decision they make, they will definitely post on Twitter. So that's a better way to get informed, because this situation is not normal and everything keeps changing, and there are multiple announcements, and it's not possible for us to get every website and get all the latest information every time. The other question was, after step 3, can we apply for multiple times or different time frame? You can apply. So I didn't understand the question. So if there is always the thing like, if you fail in the first attempt of step 3, so there's always a negative point for that. So it's better to get step 3 just for once and get over it. You can definitely apply if you fail step 3, there's no limit. You can definitely apply again, but it's better to get over it just for once. That's all.
The limit in time frame when you can take step 3 after your step 1. You have to take all the steps within 7 years after you have taken your step 1. That's the time limit they're talking about, I think.
Yeah,
There's
I think
about advice for old graduates just regarding year of graduation. So the longer you are out of medical school, it becomes difficult for you to match. That's the bitter truth. What they want to see is the longer you are out of medical school, what you are doing in that gap. How are you filling the gap? They want to see you being clinically active. So as long as you can prove that you are clinically active in all those years, that can help, but still it becomes difficult and difficult the longer you are away from the medical school. Within 5 years, like Rajendra said, is still good. 5 to 10, so. After 10, very difficult. 3 years is the best time frame. They do prefer younger graduates.
Okay, so I think we came to an end. It's long, and I think if anybody has to say anything short, please put your last word, and then we'll end the meeting. Anybody
I
has
think
anything?
everyone did an incredible job, and all the presenters actually have shared their emails, just in case if anyone has any questions. So I know it was a very long stretch. We planned for maybe an hour and a half meeting, but it actually went beyond that. So I think we should actually end the presentation here. Thank you, Prakash, Rajendra, Sumit, both Sumits, actually there are two Sumits, and Apurwa, and the Koshish members, Dr. Dibya Ramgyan, and everyone involved on the other side. Thank you, everyone. I hope the presentation, we hope actually the presentation that was provided would be helpful for everyone watching, and I think it will be in Facebook or YouTube at some point, so you can watch, and also email or contact one of us or any of us. Vijay, anything you wanted to say?
So yes. Just I want to emphasize one thing: the help is always there. If you want to reach any one of us, you can approach Ramgyan or you can approach directly. We might be most of us are already friend on Facebook, or you might have our email address or phone number, so you can reach. Other things I want to emphasize: during your application process, if you come to US and unfortunately you didn't match, then there is a site called IMG Residency, and then they charge some money. I think around $500, and they will prepare all your application in one frame. They'll put your picture, they attach all the LORs, and throughout the year they keep sending your applications to all the programs. After match I'm talking about, because after match they might, some resident they don't get visa, or some visa issues, or some sickness, health sickness, there might be the position gets vacant. So in that, they keep sending applications to all the programs, and they keep you updated on your behalf. So some residencies find it very helpful. They help them to get into residency. So that is the help also. So after that, thank you so much for wonderful audience, and I hope that we answer your questions, and hope it will be this presentation gonna be helpful for you to making your decisions and your USMLE journey. Thank you so much. So I'm gonna end it now. Thanks again.